The information provided on this podcast is for general informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your qualified health provider with any questions you may have. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. Reliance on any information provided here is solely at your own risk.
Welcome. This is Birth, Baby. Your hosts are Ciarra Morgan and Samantha Kelly. Ciarra is a birth doula, hypnobirthing educator, and pediatric sleep consultant.
Samantha is a birth doula, childbirth educator, and lactation counselor. Join us as we guide you through your options for your pregnancy, birth, and postpartum journey. Thank you to our listeners for your continued support. If you enjoy our content, please be sure to like, follow, rate, and review wherever you listen to podcasts. This helps us gain visibility to other people that could benefit from listening in. Hey everyone, today we have an episode for you with a pediatrician named Ross Newman, Dr. Ross Newman. He has 4 kiddos of his own and he is a pediatrician in Oregon and he has been practicing for 10 years now. And he's here to talk to us about a controversial topic of, drumroll please, vaccinations in kids. So we're just going to tackle the topic. And I want to start off by saying to everyone listening, we love you all. We are totally fine with whatever you choose for your own kiddos. We serve a wide range of people in our practice. And we just really want this information so that we have it out there. We have some evidence-based information. So thank you so much for being here with us today.
Of course.
I am very excited to chat with you. I found you first on TikTok. You have a TikTok page and you do like all sorts of really great videos about addressing all sorts of things with pediatrics, but specifically you talk a lot about vaccines. And the way that you present your information on TikTok is just, it's so great. I think it's so easily digestible by parents, by me, also a parent, and, also kind of in the medical world, but it is just refreshing to have someone presenting the information in, a pretty straightforward, like, here's what it is, do what you want with it. And I think that's awesome. So we're excited to hear a little bit and learn a little bit today from you.
Awesome.
So, to start us off, can you tell us how, we're going to go in real hot, how vaccines work in the body and why they are effective at preventing disease?
Yeah. Well, so my background, I'm a human physiologist by training. So my undergraduate degree is in human physiology. I, worked in a lab all this time before I went to medical school. So I love human physiology and we'll nerd out on it all day. But the biggest issue with understanding how vaccines work is that the people we're talking to don't have that background in human physiology, right? We have people who, maybe have just limited biology from high school all the way through PhDs in science. But if you haven't studied immunology and physiology, you can be a brilliant scientist in biology and no idea how this works. So the real important part is being able to break down complex interactions at a cellular level onto something that somebody can understand. And really, it comes down to vaccines teach our body how to defend itself. So, for example, I always go back to the Independence Day movie. So in Independence Day, the aliens come, nobody expected it, and they did a lot of destruction, right? And then a lot of years later, Independence Day 2 comes, and all of a sudden, we had all these defenses ready, right? We knew what was coming. We were ready to battle, and they were not able to surprise us. And even though there was some, casualties or small infection, I say because we're talking about diseases, the aliens weren't able to hit us as hard. So our bodies do that exact same thing, right? So if we don't have a vaccine, when an illness comes, it is brand new to our body and it takes us by surprise. It'll take over our cellular machinery. It'll get us very sick, whether that's with, gastrointestinal issues like vomiting or diarrhea, or respiratory issues like cough, or even neurological issues like it can affect our brain. And our body has to learn on the fly and be responding as it goes, and it can make us very sick. What we do with a vaccine is we give a training course, right? We give a small amount of a protein. A protein is part of the virus or bacteria. Generally, we use the landing gear. So all viruses and bacteria, they have to land on our cells in order to take advantage of that cell or infect that cell. and then they can do what they want. So we take a piece of the protein of the landing gear and we show it to some of our immune cells. Those immune cells then share it with other immune cells that can then make a whole bunch of things we call antibodies. Antibodies are the way that our body shows everybody the wanted poster for the thing that we're trying to defend against. And then they'll recognize it and they'll know exactly what to do when they see that. So many times an effective vaccine will not only prevent a serious course of the illness, but will prevent an illness altogether. Just like a wanted poster for a fugitive, if you see that person before they're able to commit a crime, you prevent the whole thing, or somebody recognizes that person right as they're starting and can stop it before it becomes serious. There's all sorts of physiology in there about, antigen presenting cells that catch the protein and then present it to a T cell. And the T cell's like the natural killer and it destroys it and then presents that to the B cells, which go and make antigens or antibodies. But we don't really need to know all that. All we need to know is that vaccines teach our cells how to respond to an illness that it hasn't seen yet. So when it does see it, it's ready to fight it off.
Gosh, as a parent who, first of all, I wish you would talk to me 14 years ago because I have a 14-year-old and also a 7-year-old or almost 7-year-old. But I've been on every end of the spectrum of I didn't even consider it when I was going to have my daughter 14 years ago. Of course I was going to give her those shots. I didn't even think about it. And then, she was 1.5 or 2, somebody scared the crap out of me. And I was like, no more, never again. I'm not doing any more. And I stopped completely. And then I became this anti-vax kind of person just from fear. I just didn't know. I was like, I'm not going to do anything else until I know more because that seems irresponsible. And then, then I have my son and now I have to make these decisions again. And that was really hard for me. And my husband was like, of course we're going to vaccinate him. And I was like, of course we're not going to vaccinate him. And we kind of had to do this, dance around each other. So I really love this episode and that you're willing to come in and talk to us because some of the fears that I had a long time ago, we encounter families all the time asking what we think about vaccines. And I'm like, I cannot make this decision for you. You've got to go out there and find the information. But one of the things that parents have a really hard time with, even if they're okay with vaccinating, is they don't want to vaccinate all of the things that are on the schedule at the same time. And I had a pediatrician with my son that she was like, well, you don't have to, but honestly, I think it's better to give them at the same time than to spread them out because otherwise you're overwhelming your immune system every month rather than just doing it at once. So can you kind of explain to us, if it's okay, if it's better to give them all at the same time at that age that it's recommended on the CDC schedule, or if it is better to spread them out, or if my pediatrician was right, why is that better or why is it not?
And it's a huge question that, I get asked every day. And the answer is it doesn't matter as much as you might think. Okay. So the big deal is, one, we want to get children protected from illness that is going to affect them right now, right? So a lot of those first vaccines are things that are uniquely dangerous to children under 1 year of age. So if we're talking about Haemophilus influenza B or Hib, we're talking about pneumococcal bacteria, which is in Prevnar. We're talking about pertussis. These are things that even 100, 150 years ago, our grandparents, their babies were dying to meningitis, ear infections, pneumonia. Those were the top infectious disease killers. And people don't realize that. And so, even if you look back 150 years ago, children under the age of 2 had a 46% chance of dying. They just passed away from fevers, and that's all we knew. And now we know that it's these bacteria that are in our environment that cause infections in very normal places like ears and noses and lungs. And so getting those vaccines for kids that are uniquely susceptible to those illnesses, our children under 1, in a rapid timeline is very important because if you don't, by the time that kid comes in, that 3-month-old comes in with a pneumonia that is now, because their immune system isn't fully going, is spreading to their liver, is spreading to their brain, is spreading to their spine. That's too late, right? So the first point of reason we get vaccines early and on time is to protect the uniquely susceptible children, especially our infants, okay? Right now in my community, we have an outbreak of whooping cough. And so every 6-week-old that comes in, I'm like, we got to get your whooping cough going because mom's immunity is only going to last 4 to 6 months. We got to get baby's immunity going, keep them protected. The second thing is we know that baby's immune system is forming during that first year of life. we have this really cool organ right above our heart called the thymus. And the thymus, its main job is training immune cells to recognize what is baby and what is not baby. So it basically, everything the baby comes into contact with, external, internal, is running through the thymus. And the thymus is saying, okay, this belongs to you, don't attack it. This doesn't belong to you, make antibodies for it. And we don't know really well. The thymus is actually kind of a mystery organ in the sense that it kind of disappears by age 1. If you get a chest x-ray of a new baby, there's this big old shadow above the heart called the thymus. But by 1, it's kind of gone. And in adults, it's mostly just like almost like a belly button. It's just very small tissue, which is just older remains. And we don't know very well why that happens. But there's a lot of hypotheses out there that, that first year of life is when baby's making immunity that's going to last them a really long time. So a lot of really smart physiologists are of the opinion that things that babies are introduced to in that first year of life are going to have longer lasting immunity. Now, we know that immunity is variable. Some people will get their hepatitis B series, and by the time they're 17 or 18, they don't have immunity. Some people will get it and they'll have great immunity their whole life. And we don't understand exactly all those factors that go into that. But it does seem to be that things that kids are exposed to, both vaccines and in natural form early on in life, do create a longer lasting immunity. And then the final reason that we, I say do stick to the schedule is because we can reduce the number of pokes, right? Every time your baby gets a poke, that's what pisses them off, right? They don't care about the antibodies or the antigens. They care about a piece of something penetrating their skin. And then you feel lousy. You get some localized redness, some swelling. And for a baby to have a sore leg, I mean, I don't know if you had a man with a man cold or how they complain about their flu shot for 6 weeks afterwards.
That's so good. I talk about man colds in my childbirth classes all the time.
Right? These little babies have sore legs. And honestly, their life's kind of cush. So having a sore leg is kind of the end of the world. And they feel probably a little lousy. We suppose that there's a little bit of fussiness. And when you get a combo vaccine, all that happens at once, right? I don't like to use the term overwhelming their immune system because their immune system is highly capable of processing thousands and thousands of antigens a day. And with a single vaccine, each vaccine introduces 1 to 2. So if you do combo vaccines, you may be introducing 10 or 8 to 10 new antigens compared to the thousands they're already doing. It's not a big deal for their body. And so decreasing the number of pokes, the number of times they have to go through that kind of feel lousy process after vaccines is beneficial for the child in general. All that being said, I have lots of patients that choose to do 1 vaccine at a time, 2 vaccines at a time, and they come in for more visits. That's totally their prerogative. That's okay. They're the ones that have to deal with that grumpy kiddo. That's fine. That's no big deal. I do prioritize pertussis, Haemophilus influenza B, and our Prevnar because I want to get those in really protected. And then some of the other vaccines will spread out and and we try to get them all done in that first year of life.
And are they usually doing that because they're worried about what if they have a reaction to one vaccine and they're like, we want to be able to pull out which one was the issue? That is usually the fear in parents, right?
That or the concern of, getting too much at once, right? There's a lot of concern about, preservatives or ingredients. When the nice part also about combo vaccines that we kind of forget is, when we have individual vaccines, every vaccine needs a preservative to keep it from growing bacteria or fungus while in shipping, right? But in a combo vaccine, we can actually sometimes decrease the total amount of preservatives in there because one preservative can preserve multiple vaccines. So that's another kind of just thing to think about as we're thinking about ingredients and preservatives in these, products. Combo vaccines can be a helpful tool to decrease that exposure as well.
I'd never thought of that. That makes a lot of sense.
Mm-hmm.
I can say, as a mom of a 5-year-old who fights tooth and nail, goes into full fight or flight, will take anyone to the ground when they give her a shot. Spreading them out for our household would be it would be a hot disaster. It takes multiple nurses to get my girl vaccinated.
I have 2 good ones and 2 bad ones. And boy, my 14-year-old is still a bad one. So if I was going in every month for a vaccine, I would be enemy number 1, more so than I already am.
You got to wear full body gear with my girl. I love her to death. She's spicy. So what about, also speaking of my girl, she likes to eat everything, puts her mouth on everything. She's just a pretty disgusting human. And we joke all the time about how she is just building up her natural immune system. So how is getting an injection of something different than ingesting something?
Also, this is my question because I hear a lot of people ask that, they're like, do you see the black box warning on that vaccine? I'm like, okay, but that says like for IV or for ingestion, not for intramuscular injection. So can you
Yeah.
kind of break that down for us?
Yeah, that is such an important point. When we do vaccines, we are doing what's called an intramuscular vaccine, right? We are not hitting the bloodstream directly because one, can you imagine trying, if anybody's ever tried an IV on a child, right? That is a hard task to do. They have tiny little veins and they're moving, and lots of times kids have to be sedated when you're trying to do an IV. So it would not be feasible for us to try to do an intravenous or intravascular injection on these children directly to the bloodstream. Way too hard, way too much time. And so what we use is an intramuscular injection. Normally for kids, we're going into the leg, right? Or the bottom. We're looking for a big fatty muscle. And in older kids, we're looking at the deltoid muscle, right? Easily accessible, a large muscle. The reason why is that the muscle is not a direct source of the bloodstream. It allows for this variable absorption through time because the muscle tissue, yes, it has blood flowing through it, but it also has a lot of connective tissue like fascia, which are these kind of thick tendinous layers that don't have great blood flow, right? It also has a lot of fat. It has a lot of muscle tissue itself. And so there's not as much blood flow to those areas. So the absorption is going to be slower compared to obviously an intravascular or intravenous injection. When we're putting things in our mouth, we are putting things directly into the part of our body that is built for absorption, right? From mouth to anus, it is filled with chemicals like enzymes and receptors and very close intestinal blood barriers that allow for rapid absorption. That can be passive absorption, meaning something's flowing from an area of high concentration to low concentration, or active absorption, where there's literally a receptor that grabs things that it recognizes and uses energy to move it across into the bloodstream. Both of these mechanisms make the gut an amazing absorptive thing, you know? And that is one of our first layers of defense. So there's a lot of reasons why when your kiddo puts gross things in their mouth, they don't get sick. One is because they've been doing that since they were coming out of the birth canal. The birth canal is filthy. And that's where they first start to get their bacteria and their immune system, right? Coming through the birth canal, latching onto mom's skin. Mom's skin is also very full of bacteria and fungus.
Sorry, I'm having a hard time. You just called our birth canals filthy. I'm a little offended.
I mean, there's a lot. There is maternal feces, there's baby's feces, there's amniotic fluid, there's blood, there's vernix. I mean, there's a lot of stuff going on there, right? And then our skin is also full of bacteria and viruses and fungus that just lives on there. And the first thing baby does is they naturally go to mom's breast, which is full of bacteria. And we actually know that's a good thing, right? That's where baby starts to get its first immune system. Those probiotics, those bacterial colonies come from the birth canal. They come from mom and they come from breast milk. So that's all really good. That is the beginning of baby's first immune system. So when they start to get things in their mouth, they're already got antibodies. Mom's breast milk also comes with this unique antibody that coats their mucous membranes both on their nose and inside of their gut. And so they have an immune system in place from the birth canal, from mom's breast milk, and it resides in that gut. So a lot of the reasons our babies don't get sick as much from things they put in their mouth is because their immune system there is already established because of mom, because of all these great things. And what we're working to establish is an immune system that not just is in the gut, but is everywhere because baby's going to be exposed in their eyes. They're going to be exposed in their nose. They're going to be exposed in their mouth. They're going to breathe things in that are going to infect them. And we need that immune system to not just be where breast milk can touch and help. We need it everywhere. And babies do get sick. The main reason your infant gets sick is because they put something in their mouth, right? I see toddler diarrhea that lasts for weeks, and I just see kids licking their shoe. I mean, they get in the car seat. What's the first thing they do? They take off their shoe. They put in that shoe in their mouth, and you haven't realized it till 30 minutes down the road, and you're just like horrified.
Kids are so gross is the moral of this whole story. Okay. You've kind of already touched on this a little bit because we've mentioned a little bit about, ingredients and preservatives and things like that. But one of the biggest concerns around vaccines is if it was like, well, if it was just the, whatever we want to have them be not having, if it was just that, if it was just the hepatitis B or whatever, but it's all of the other stuff in it that really makes people uncomfortable. So can you talk a little bit about these vaccine ingredients, clarify what is in a typical vaccine, and can we talk about aluminum versus aluminum salts? Because people really get stuck on the word aluminum. I did.
Yeah. So all vaccines, the goal is to present a protein in its pristine form. Remember, it's the protein that most often is going to look like the landing gear of the virus or the bacteria we're trying to defend against. But proteins are these folded macromolecules that, if they come unfolded or come out of their form, they no longer are recognized. They're just basically amino acids that our body will just eat up. So, in order to preserve that protein in its folded, nice form, it's like carrying an egg, and you're like trying to give that egg to the immune system, and you have to give it some padding. You have to give it some ability to be protected. And part of that is making sure its chemical environment has the proper pH or acidity and basicness. It has to have any molecules that'll stabilize it. Sometimes that's sugars or other fats or other proteins will stabilize it. And we have to make sure that that bacteria and funguses don't grow in that solution while we're storing it, because you don't go right from where it's made to right into an injection. And the final thing we need is some vaccines respond better when they have things called adjuvants. Adjuvants are like the peanut butter to the jelly, right? Or whatever your thing is, whatever you like to combo. For some people, it's like Takis and hot sauce. They go well together and they make the vaccine have a more robust immune response. And some of those are enzymes that we found in nature. Some of those are elements that we found in nature. And really, just by the scientific process, have found out that those work well together. So specifically, most vaccines, and on my TikTok page, I actually go through almost every vaccine and I read the insert and I say, this is what this ingredient is. This is what it does. This is why it's in there. And this is where it occurs naturally in nature. So some of the ones people get concerned about are like formaldehyde or sucralose or other like antibiotic preservative. Those are things that our body makes and uses naturally to preserve ourselves, right? But let's hit the aluminum, because that is a big one that gets a lot of talk. Aluminum is one of the most naturally occurring elements in the crust of our earth, right? Up there with iron. And so it is in everything. If you take a deep breath of dust, you're getting a huge dose of aluminum, right? Breast milk has a lot of aluminum in it. Our food sources have tons of aluminum. Our water has aluminum in it. Aluminum occurs naturally in our body. It's mostly gotten rid of by the kidneys, and it will form a salt. So it will ally with a negatively charged ion and create all sorts of salts in our bodies that can then be excreted via the kidneys. When we use aluminum in vaccines, it is in that category of adjuvant, something that helps boost the vaccine's ability to create an immune response. And we don't have we have a decent idea about it. Science is still always developing, but we don't have a hugely great understanding of why it does. But we know it works very well to create a longer lasting and more robust antibody response than with that protein alone. And then the second concept we have to understand is levels of toxicity. Everything is toxic in our lives. Water is toxic if we eat too much of it. Vitamin E and vitamin A, highly toxic if we eat too much of them. And one of the most important things that we use all the time in our body and in medicine is iron, right? We talk about iron deficiency all the time. We prescribe iron. Iron is a hugely toxic element when it's outside of its therapeutic range. So aluminum is generally considered within its therapeutic range when it's less than 1 milligram per kilogram. And that's for infants and adults. Okay. Most babies are born around 3 kilograms. That's kind of an average, right? You might get a real small one at 2 kilos. You might get a bigger one at 4. Heaven forbid you get a 5 kilo. They happen, right? But when we're doing vaccines, none of our vaccines individually have more than 0.25 milligrams of aluminum. Okay, that's the largest single vaccine. And if you're taking your average baby at 3 kilograms, that means that baby could easily handle 3 milligrams of aluminum at any day. And so we're giving them what, like 1/12 of their potential dose. That still leaves room for them to get their aluminum from breast milk, their aluminum from formula, their aluminum from breathing, or if they're eating solid foods. If you do the biggest combo vaccine, where you get all the vaccines at once, you get, your Hep B, you get your rotavirus, you get your Prevnar, your Hib, your DTaP, the biggest dose is going to be 0.8 milligrams. So really, and by that time, the baby's generally 2 months old. So we're really talking about a 4, 5, 6 kilo baby and a really chunky baby, right? So we are still so much below, at least 12% of their tolerance of aluminum that their body can tolerate. So then if we compare to other sources of aluminum in a baby's life, if a baby's to breastfeed for their first year of life, they're probably going to get exposed to around 7 to 8 milligrams of aluminum. If they're going to be formula fed, that could be up to 40 milligrams of aluminum. And if they're using a soy formula, I mean, that's over 100 milligrams of aluminum because that soy has a lot of aluminum in it. And so, really, it all is about we are giving very small doses for a very specific purpose and well within the documented safety range of that. And our body just sees it, binds it with a negative ion, puts it into the fluid that goes to the kidney, and it's peed out just like all the other things.
That's really interesting. Yeah, I'm someone that doesn't react well to iron, so that kind of speaks to me. I have hemochromatosis, so my body doesn't process iron well.
Yeah.
So I very much understand that. We all have different levels of tolerance and our body reacts differently, but that makes a lot of sense. To hear the rest of our chat with Dr. Newman, be sure to tune in next week. Thank you for joining us on Birth, Baby. Thanks again to Longing for Orpheus for our music. You can look him up on Spotify. Remember to leave a review, share, and follow wherever you get your podcasts. See you next week.